Hi, my name is Dan Tache. I'm a dentist and I'm practicing in Green Bay, Wisconsin. And I've been asked to speak on a subject today that for some of you may seem so remote from dentistry. I hope you hang around long enough to let me go through this presentation, and maybe you'll see the relevance of having a better understanding of sleep medicine, and I'm going to call it dental sleep medicine, because I think you'll see how having some of this knowledge will interface very, very well with your everyday practice of dentistry, not to mention getting involved in the emerging role that dentists are playing in managing sleep and breathing problems, and it is significant. But if you've ever had to deal with a patient who grinds his or her teeth, or has a TMJ problem, or recession, abfractions, those everyday dental problems that people are confronted with, that we have to help them with, maybe you'll understand after we go through these slides, this presentation, how knowledge can help you better manage just those problems alone. So we have some presentation, some slides here that will help prompt discussion and conversation about the subject. And if you'll hang with me when we get to the end of this, I hope you'll see the relevance. Sleep disordered breathing are people who have trouble breathing at nighttime while they're sleeping. Is probably something that's not too new to all of you, but what you probably don't understand is that a lot of people have trouble getting treatment for the problem. They go to a sleep doctor because they might snore or have cardiovascular problems, and someone thought it might be related to sleep, and all of a sudden they're wearing a breathing machine, or maybe they're coming to your office because they can't wear it and they're being asked to get this oral device for snoring and sleep apnea, and you're wondering what to do. Well, all those things may come your way, and to have an understanding about basic sleep medicine will help you better understand the role that you play. So we'll go through some basic information, and maybe at the end of it we'll pull it together, and you can see the role that you might be able to play, and how it just might apply to your practice of dentistry. I hope so. Central apnea, obstructive sleep apnea, those are the two basic categories of sleep and breathing problems that confront medical doctors every day. And because we have an emerging role in the management of obstructive sleep apnea, you'll see those patients as well. Just so by means of definition, central apnea is just almost like when the body or the brain just forgets to breathe at nighttime. Actually, a mouthpiece, even a bruxism splint, a retainer that you might make, can affect a person's ability to remember to breathe. So central apnea can be affected by mouthpieces. So if you're making bruxism splints, for example, or you're actually involved in treating people with sleep and breathing problems, be aware that if they have a decline in their health when they start wearing this, it might be because central apneas have actually increased. It's not as much of a problem with mandibular advancement devices, but suffice to say, it can be impacted by what we do. Obstructive sleep apnea basically was in the body stops or is unable to breathe well at nighttime, and as a result, you have a degradation of sleep. They don't have enough oxygenation, and so they have basically a breakdown of the body. Their nervous system, their sympathetic nervous system might kick in, and they'll wake up sweaty and tired because the apnea causes arousal from sleep, and you'll see some of these patients because many of them can't tolerate the traditional method of managing it using positive air pressure machines, and we'll talk more about that. And the fact is, obstructive sleep apnea can reduce the length of your life by 8 years, and can make it a whole lot more miserable up to that point, because you can have the development of cardiovascular problems that, had they been diagnosed at an earlier date, might have been prevented. Other things that are impacted by obstructive sleep apnea that's not managed well are type 2 diabetes. Diabetics typically have a hard time with weight control, and if you have obstructive sleep apnea, or if your patients do, and it's not being managed well, they'll have a very hard time taking care of metabolism, because if you're not sleeping well at nighttime, you don't get what's called the growth hormone release, and people will put on more weight, and diabetes is a comorbid problem that often accompanies unmanaged sleep disordered breathing problems. Obstructive sleep apnea basically is described by a couple of events that's going on. In obstructive sleep apnea, where you have physical obstructions to breathing, and we'll talk about how that happens in a moment, you may actually have the lack of airflow, 100% flow limited breathing, and that's called apnea. And typically, that's defined as a 10-second sensation in breathing at all, and often you'll see a decline in oxygen saturation, 3 to 4% or more, and that can cause a body breakdown and often can lead to microarousals from sleep, which can add to people's fatigue, depression, and anxiety. So in obstructive sleep apnea, you can have an apneic event, or you can have a partial obstruction and a hypopnea, where you have about a 50% reduction in breathing ability for a 10-second period of time. And again, that's often accompanied by a decrease in oxygen saturation levels, and again is often accompanied by a microarousal from sleep. You're not aware of it, but you're awakening, you're coming out of deep sleep, and this might happen 20, 40, 80 times an hour. Imagine having awakenings that much. How tired would you be? And the way this interfaces with dentistry, even if you're not interested in managing dental sleep medicine problems, take a patient who grinds his or her teeth. They have abfractions, they have recession, they have TMJ problems, and you're just having a whale of a time managing that. If you know that they snore, that puts them in a high-risk group for sleep disordered breathing, like sleep apnea. And the reason I'm so excited about this is because for years I've attempted to manage orofacial pain without this knowledge. And when I started understanding this, I realized that a lot of people who clench and grind their teeth do so because of these microarousals. And so if you have people who grind their teeth and they snore and they're maybe a little heavy in the neck, and there's some indices we can talk about, this is going to affect your life. A diagnosis of obstructive sleep apnea is arrived at by observing or deciding what the apnea-hypopnea index is. That generally is made, that diagnosis is made by a sleep physician during a sleep study in a hospital, and it's overnight. And the apnea-hypopnea level is adding the number of apneic and hypopneic events and dividing it by the total sleep time, or the number of hours of sleep. And that number will be anywhere from 0 to, well, it could be as high as 100 or more. But generally speaking, mild obstructive sleep apnea is described as an AHI of 5 to 15 events. Moderate would be 15 to 30, and then severe would be an AHI of 30 or more.